So we're throwing 217 dentists in the city.
Right, and not
every
many
year.
are retiring because not many dentists can retire now because of what has happened with their portfolios. You know, a lot of people lost.
No, it's the alimony payments.
And that. I mean, a lot aren't.
Just
they're
keep your
just
husband
keep on
for
working.
financial reasons. Just say, you know what, you're just.
Okay, so it's a distribution problem, but then another problem too is, let's get back to the etiology of the disease. What is caries? Do fillings and crowns cure caries? No, they're just treatments for the disease, right? So just having more people doing more of the things that are not cutting the disease incidence is not going to improve our oral health. So now let's look at spending. So the Oral Health Initiative, I believe it was, looked from 1990 to 2010 that the rate of caries, untreated caries in children, remained stagnant at 30%. And then in underserved,
Arizona?
just overall, nationally. And then in the underserved population, it was worse at 50%. So we have not improved that. But our spending went from 1 billion to 7 billion, and then it's projected to go to 15 billion by 2020. Is that sustainable? To keep doing more of what hasn't worked? So, you know, that's where you start to look at, like, we need to redirect the bus. Like, where is this bus headed?
How would you redirect the bus?
We need to get back to the disease process. You know, focus more on prevention. Like we talked earlier, the headline of, oh, the baby dies at the dentist. Well, again, what are you feeding your kid? Are you using fluoride? Are you brushing their teeth? You know, let's prevent the problems from happening where the teeth get so rotted and infected that they have to be sedated for work. Don't blame it on the dentist. Let's get back to preventing the disease. We don't. Do you know Kirk Robertson from Flagstaff Around the Mountain Pediatric Dentistry? He's a wonderful.
Kirk who?
Robertson.
No.
So he had a great.
Send me his Kirk Robertson.
So he had a really profound, I thought, statement about trying to rationalize the issue with why dental therapy is not going to improve our situation, in that, like, when we were dealing with the problems of smoking and lung cancer, how did we tackle that? Did we say we need more surgeons to cut out the diseased lungs? You know, no. We need to put money into prevention and education to teach people what would happen if you smoke, right? You know, let's get back to prevention, or shifting the focus of treating the disease, especially with children. You know, how can we reduce costs and improve outcomes? For me, I've been able to do that with silver diamine fluoride. So since 2014, i.e. before SDF in my practice, I've reduced my use of sedation 67%. So if you think of that in a state with one of the worst caries rates in the country.
Why are we that state?
The Southwest in general has higher caries incidence. So a lot of it is diet, hygiene, low SES, education, socioeconomic status. You see higher instances of caries in those populations. But as I'm reducing my sedation, I'm also reducing costs to access. When I can do less invasive procedures like SDF or smart fillings or Hall crowns.
Smart fillings?
So silver modified atraumatic restorative treatment. So,
say that
you know,
you're talking over my head. I know I'm old, senile, and slow, but you're over my head.
So SMART,
what's a smart filling?
Is an acronym for silver modified atraumatic restorative treatment. So ART, or atraumatic restorative treatment, came into the eye in
silver
1994.
Modified atraumatic
restorative treatment. You know ART, right? Atraumatic restorative treatment. You're using glass ionomer and just.
Well, okay, can I take you off on a detail on that real quick? Another thing I lived through, you know, where I think dentistry is going the wrong way, is when I started this 30 years ago, all the fillings were silver and all the crowns were gold.
And did you see a lot of recurrent caries around those silver fillings?
No.
And why is that?
Because silver is half mercury, which I've never found in a multivitamin. And the other half is silver, zinc, copper, tin. Stannous fluoride is tin. Mm-hmm. Silver diamine fluoride. The whole amalgam's out.
Is antimicrobial.
I know. Yeah. And now you're like a horrible dentist if you use amalgam, and they're using these inert plastic composites which are basically, and I'm telling you this, that for 30 years taken out, and then the dentists are just so dumb. They say, oh, it cracked the tooth. Dude, it was in there 38 years,
Right.
you moron.
Yeah.
And now you're taking them out and putting in a plastic filling.
That's going to last on average how long? Is it
6 years.
6 years?
And you take, they say, well, look at this amalgam, there's black scuzz. Dude, look under
cares?
composites.
Black is beautiful.
Number 4 round burr mush oatmeal coming out of
Yeah.
it. So why do all the pediatric dentists not use amalgam?
I use amalgam.
God, you just,
I still use
is that
amalgam.
why you're
It's a
wearing
great
back and black?
Back and black. Well, let's get
So
get
what
back
percent
to
of
the
your
disease.
fillings are amalgam?
It's a small percentage because most parents are, again, thanks to the electronic age, social media, they're afraid of the silver fillings. And
Well, tell them they'll never see
toxic.
the silver because the orange Cheez-It will cover
Precisely.
the amalgam.
That's a great point. Yeah. But there is this demand for the white fillings. But it's not just so there's concern for what's in the material, but there's also concern for the appearance because if the mouth is full of silver caps and
Do you
fillings,
think
it makes them look like a
amalgam
bad
is
parent.
toxic for a child?
Well, mercury is toxic at certain levels, sure.
But do
if
you
I
think a
put
silver filling is toxic for a child?
No.
Yeah. Yeah, and that's the other thing, these dentists, I mean, it's like, how did you get out of dental school? I mean, silver, an amalgam, it's an insoluble salt. I mean, all you got to do is triturate one, swallow it, and the next morning, there it is in your stool, and you can get it out and weigh it and swallow it again. But through burning coal, in my lifetime, the ocean's gone from 1 part per million mercury to 4 part per million, and that's a free absorbable ethyl methyl mercury. You know who the top scientist really is on that? At U of A. And he did a ton of research on, well, I don't want to say abortion, but aborted babies, you know. And all the ethyl and methyl mercury in their brains was from eating seafood, not from dental filling.
Right.
And so you see these dentists taking out all these silver fillings, and they're wearing a NASA spacesuit and making a psycho show out of it. And then at lunch they go eat 6 popcorn shrimp and have salmon in their salad. It's like,
Right.
I mean,
Well,
come on.
I still have amalgam. I think it's a great material. There's very little interest in it. It's not always people's choice. It's funny how much more accepting they are of it when that's what their insurance pays for.
Oh, and then so do you think
All of a sudden
Medicaid?
it's okay.
Do you
Like,
think Medicaid and Medicare for the poor, getting their filling done with redistributing money from other people, do you think they should just say we only cover amalgams?
I don't think that's fair either because now let's get back to self-esteem issues where you might have a kid some kids think their silver fillings and crowns are like so cool and then all their friends want it and I've actually had siblings fight over who had more silver caps.
Really?
Which is like way to have a positive attitude, but there are some kids who are mortified by it, which is really sad. So I like to give options, and if they want the white, let them have the white filling.
I had a problem with an insurance company in when I got here in '87, and the guy lived right around the corner. And he never even thought about it. He was paying, I forgot the average fees, but it was $1 cheaper to pull it. No, it's $5 cheaper to pull it than to do the amalgam.
Right. Wow.
And so all the moms, I'm sitting there at this Medicaid clinic in Glendale, and the moms would all day long say, well, it's cheaper to pull it. And I'm like, yeah, but you don't have a tooth. So I got him to flip those.
I have a problem with them forcing, like, you can only have this or that. And that brings us into another fear that people have, dentists have about SDF, is there's this fear that somehow, especially Medicaid, will then say that's all you're allowed to do. And I don't want that either. I think that's ridiculous because SDF is not a cure-all. It's a treatment for caries.
How
but
many
it doesn't
pediatric
restore.
dentists are there, and how many are endorsing this? How many pediatric dentists are there?
SDF
many
has
would you
had the quickest adoption. The people who brought it, Elevate Oral Care, the people associated with that also brought fluoride varnish to the market in the U.S.
Elevate Oral Care out of Florida?
Yes. So, I should look at newer numbers, but they estimate that the adoption of SDF has been 4 to 6 times faster than varnish. And I remember
Can
a
you
day
send me
and
that,
time.
Ryan? Elevate Oral?
So I remember a day and time where varnish was new, and, you know, some people use it, some people didn't. But now if you go to the average pediatric dentist's office, like, we're all using fluoride varnish. And now, you know, not every pediatric dentist is using SDF yet, but there has been this astronomical rise of adoption of incorporating SDF into their practice. And I do give a lot of that credit to the New York Times article for not only bringing their attention to it, because they maybe didn't learn about it in dental school, not maybe, actually, and then also the public demand, because you have patients asking for it by name, so then that
So that's where you buy yours. If my
it.
homies want to order this, that's where you're ordering it?
That's the only place in the U.S. that you can get it. They are the exclusive distributors of silver diamine fluoride in the United States.
And they're distributed from where? Who's making it?
Palm Beach, Florida. It's their own small company. They're not
So they're not
they don't have any
distributor, they actually
second
make
party.
it.
They make it and distribute it themselves.
Elevate Oral Care.
And they also make varnish and other mostly preventive products. But you know, I don't
So
think
the
that
website is Elevate Oral Care. ElevateOralCare.com. The only place that makes it and sells it. And they got anything else? They got sodium fluoride varnish. You like that too?
Right. I like their varnish is a 2.5% varnish. It's more like a shellac, so it's nice and thin. That's probably the other most common product that I use from that. And it comes in a bottle, so you can put out just a little bit as opposed to wasting a whole unit dose, because I put varnish over my SDF applications.
So I want to read something off their website. The Back and Black. Dr. G.V. Black, often revered as the father of modern dentistry, described the use of silver compounds to treat teeth as far back as the late 1800s. In 1906, Dr. Black published a paper on silver nitrate, the predecessor of the 2014 FDA-cleared formula for silver diamine fluoride, 38%. Elevate Oral Care is proud to pay tribute to G.V. Black with our Back in Black t-shirt while raising money and awareness for children's dental charities with a focus on access to care solutions. Join the movement and show your support with your own Back in Black t-shirt. 100% of the proceeds will benefit children's dental charities.
Right. So that's the shirt that I brought
still
to
think you look more like Pierre Fauchard, though. I'm going.
But, you know, that came out of a gift for Jeremy Horst, who wrote the UCSF protocol for SDF, which a lot of people, it's a wonderful resource. A lot of people have used that. So I made him a little black onesie for his baby with Back in Black, with GV Black. And then, you know, our little group of SDF nerd friends were like, ooh, that's cool. I want one of those too. So I started making them. And then my friends at Elevate were like, you know, can we make those shirts and sell them? And then we'll give all the proceeds to children's dental charities. I'm like,
so
well,
who's the owner?
yeah.
Who's the owner of that?
Kevin Thomas, Steve Pardue. There's is it 4? There's managing members. Those are the 2 that I know.
But who's the owner?
Most. They're partners in it. They
There's
call
two
it managing
guys
members.
that each own
I
half?
think there's actually 4. I know Kevin Thomas, Steve Pardue.
Are
and
they
then there's
all
Rich
dentists?
Coney. No,
None of dentists?
not the ones that I know.
Well, so there's 4 partners?
I can't remember off the top of my head. The ones that I mostly talk to are Kevin and Steve, and they're some of the nicest, smartest people that I've met, and they're pretty incredible.
I know, and it's so embarrassing because here's a dentist all day long selling dentistry, and he says, well, I hate to sell. I don't want to sell dentistry. And then when I started Dental Town in 98, I owned Dentist Town, but I started Dental Town because if it wasn't for 500 dental companies, we'd be sitting out on a rug, chucking teeth with stuff we bought at Home Depot, and I would get messages like once a week to this day. Well, so-and-so is on there, and he works for a dental supply company. He's selling stuff. And I'm like, well, what are you, a volunteer? What do you work at a homeless shelter?
Right.
And to this day, Orthotown, I also own Orthotown. There's 5,000 orthodontists on there. They won't let anybody on unless you're an orthodontist. And so I have all these people asking me from these big orthodontic companies, well, what do the orthodontists think about this? I don't know. I'm not allowed to go on either because I'm not an orthodontist. I can't go on Orthotown, and I own the site. And I think of how many...
It makes you want to be on there even more, right? It's like when you're not invited into the club.
It's like the orthodontists would be served so better if all the companies making all their shit could see what they're saying about their stuff.
Right.
And keeping them out of the equation, I don't know. And America is the most dysfunctional. Because when you go to Europe, have you ever been to the IDF meeting in Cologne? So you go to European meetings, and the guy that lectures is the owner of the company. And all the Europeans figure, well, this is your company. This is all you do your whole life. You know more about it than anybody else. In America, we're like, oh, I don't trust you.
Right.
You're selling something. And then they go listen to some dentist mediator who's an expert at like 400 million things. You know, it's crazy. And so when you go to the IDF meeting, there's no lectures. So it's the biggest meeting in the world. 100,000 dentists go. It's every other year in Cologne, Germany, and Cologne is the coolest town. It was the furthest outreach of the Roman Empire. So they still have the Roman wall around there, and it's the only place you can get Italian food in Germany that's really Italian food. I just love that place. But there's no lectures, and so those guys that own that company, they would be answering all the questions, and all the Germans and Europeans want to talk to the owner, and they don't give a shit if you have a DDS or a DMD. Cool. It's like if all you do is make orthodontic brackets your whole life, I'm sure you thought about it before. You know what I mean? So is there any glass ionomer use in your practice?
Oh, I'm glad you brought that up. So going back to materials, I still have amalgam, I still do resin, I do lots of SDF, but I'm using more and more glass ionomer cement. And my feeling is in the US, we have a love affair with resin, right? Like we're bonded on us. Like that's how I was trained. And I got little to no experience with true glass ionomer in dental school. Like our glass ionomer was Vitrabond, which really is a RMGI or like a liner, you know. So I wasn't placing glass ionomer
from 3M
restorations, right? So now I'm using the Fuji glass ionomer products like Equia Forte for fillings. I use the Triage for sealants, or the Fuji 2LC, which is a light cured RMGI. But the problem is, you know, if you're used to dealing with resin and you don't know how to properly handle glass ionomer cement, you're likely to get failures. And like, what would the classic American dentist attitude be if they have a failure of the material? They're going to blame the material, and not that they don't know what they're doing.
So you go to America, and they have 3 amazing car companies called Chevy, Chrysler, and Ford. You know what I mean? Then you go to Japan, which my Lexus is a 2004 with 150,000 miles on it. The car hasn't even burped or farted the whole time. Yet every one of my children and friends who had bought an American car since then, I mean, so you go to Japan, what do they use more of? Glass ionomer or resin?
Glass ionomer.
Or
even
and they
Europe,
affect New Zealand and Australia, huge.
Yeah, it's big in Australia.
Graham Milicic, who's the guy? Jeffrey Knight. And then the Americans, they're Chevy. Chevy works better.
Right. It's really difficult. Like you talked about religions earlier. Like we get so focused on what we were taught or what we learned, and we forget to look at the big picture or to remember that, you know, our education is a lifelong journey. Like we didn't learn it all in dental school.
Do you think glass ionomers prevent recurrent decay better than resin?
I mean, they chemically bond to the tooth structure. It's not micromechanical resin tags like with the resin. Where technically speaking, on a microscopic level, as soon as you light cure it, that is leaking, and you get bacteria in there, and you can get recurrent decay. Whereas when you place a glass ionomer cement, it's actually transferring ions, fluoride, aluminum, strontium, into the dentin and the enamel, and it's this like, it's a stronger bond. It's a better bond. It's not going to have the micro leakage. Yes, you know, like for example, the Triage sealants. In time, they can wash out.
That should be the brand name, Better Bond.
In time, they can wash out. Like that's I was given these misconceptions of glass ionomer and never really used it much because I was taught that it fractures or it washes out, blah, blah, blah. But, you know, going back to your car that has lasted forever, if you look at the Fuji line of glass ionomer cements, I mean, they have been around for decades. They're the tried and true, perfected materials that are just underused and undervalued in our country. I think they only represent like maybe 3% of the market share because everyone's using resin here. Yeah, everyone's using resin.
And by the way, some people have commented that they've told me that Fuji is no longer in Japan, that it's in Switzerland.
Well, GC America is for Canada, United States, GC Europe. There's but they are in Switzerland too.
Fuji moved to Switzerland for tax purposes. Their management is still Japanese. Correct. And lives in Tokyo. What is your most common filling in a pediatric practice? Is it a 6-year molar, or is it a primary
You know what? It's a class 2 on a primary molar because the parents aren't flossing. So again, there's the education. We want to get the kids
So
in
your
earlier
most common filling is a class 2
yeah.
on primary molar?
Oh, totally.
And what percent of those are in pairs? Like
they're almost always like kissing cavities.
Because, yeah.
It's the anatomy of the molar. The primary molars are like these big rectangles with this flat, broad contact. So let's getting back to the etiology of the disease as a biofilm and bacteria or behavioral disease. If you have the biofilm in that tight contact, the saliva, which is like our natural defense against caries because it's bringing back the calcium and phosphate into our enamel, it can't pass through that contact. So you have this stagnant area where the biofilm is just having a party, and the parents aren't going in there and flossing because little Johnny cries. And, I don't want to make little Johnny cry. So they're not flossing their kids' teeth. Or the other problem, too, is a lot of times they have those cute little gaps in their front teeth. So it never even occurs to the parent when the kid is 3, 4, 5 that their primary molars have that really tight contact. They're not flossing their own teeth, let alone flossing their kids' teeth. And that's like classic. So they'll end up with, especially if they delay going to the dentist, they'll come in because all of a sudden there's this huge visible hole from trapping food between the molars.
So what percent?
That's super common.
So your most common is primary, first and second molar.
Yeah.
And what percent of those are MODO, same time, kissing cavities?
We have so many kids where every quadrant has kissing
but
lesions.
the point I'm trying to make is to the young kids is they're staring at this bite wing and they go, oh, well, there's an MO on A, but B looks good. No, B has a cavity too. Your X-ray is not an open contact. What percent of the time?
What I would do in that scenario is I'm not going to over-treat that. Like if there's a true cavitation in, let's say, the DO of B, and let's say there's an incipient lesion on the mesial of A, I'll place the glass ionomer restoration in B. I'll treat the mesial surface of A with silver diamine fluoride. And then in time, every time they brush with a fluoride toothpaste, it's going to recharge that glass ionomer, and it's going to release, it's going to share the love with the neighbor and help remineralize. So it's going to help prevent the lesion on the adjacent surface. And it's really good. Like if you have it on the distal of a second primary molar and you have an incipient lesion on the mesial of the permanent molar, in my lecture, I have some x-rays where I show where I've placed the Fuji Equia Forte as a class 2 on the distal of the primary molar, and then SDF on the mesial of the permanent first molar, and you can literally see that little black triangle, that little incipient lesion disappear.
Now do you see why her online CE course is crushing it?
So, we need to be, less is more. We have to stop.
You've already talked about 5 different articles you should write for Dental Count Magazine. Do you have cases on that you could do?
I have so many. I think
do you talk to Tom regularly?
I'm starting to get like this almost overwhelming demand to come and lecture. And before we started taping, I mentioned how I never sought out in life to do this. Like this all has kind of happened by accident. I'm just a mom and a dentist, and
how old are your kids?
Now they're 6 and 8, but public speaking scares the crap out of me.
Really? You seem like a natural.
I'm good one-on-one, and I am self-confident but when you get up in front of this audience, and especially if it's like people who question everything and it's something controversial, and my fear is they're all going to come out at me, and it's I know I'm supposed to picture them in their underwear, but
really?
Instead it's
I never heard that.
You haven't heard that?
No,
when that's just because you're confident and you do a lot of public speaking and stand-up and stuff, but that's one of the things they tell you, if you're scared, just pretend the audience is naked or in their underwear and you'll be okay.
Why you don't be scared?
It doesn't work for me.
You know why you don't be scared? It's actually insulting to tell them why it doesn't matter. I love stand-up, and I've done every comedy place in the Valley 5-10 times each in the last 20 years. But it's that I don't respect you enough to be insulted. I mean, if I say a joke, and you say I don't like the joke, I don't care you don't like the joke. I thought it was funny.
Well, my problem is I care too much.
And exactly. And so when I'm lecturing, if you don't agree, well, buddy, I don't agree with everything you say, and it's okay to disagree. So I don't care if you don't think I'm funny, and I don't care if you don't agree with me, because the first 108 billion humans are all dead, and of the 7.5 billion humans alive today, what percent will you never ever meet? I mean, how many humans are you going to meet in your life?
99%.
Yeah. So you add the 108 billion that are already dead, and the 99.99999% that are alive that you're never going to meet. So your whole life is really one-on-one. So no matter how big that room is, you're just talking to me. I mean, you're talking to one-on-one.
The more I do it, the more confident I get and the more relaxed, it becomes second half. But, it's not like I sought out to do this. It just sort of
happens. It's a law of unintended consequences.
The thing is, especially when it comes to SDF, there's a lot of interest in it, and a lot of what was initially available were more people in research and academia where they can tell you all how cool it is and the science and the literature. But for the wet-handed dentist, we want the how-to, so that I think that's why what I have to say resonates with dentists is they want to know, how does this translate into my everyday practice? What is my private pediatric dental practice? What does this mean for me in 2018 if I add this in? And I feel like I'm that voice of reason, showing people how I've incorporated into my practice and how it's benefited me. Because a big misconception is people think that because I'm so vocal about SDF, they think that I somehow am saying that that's all teeth need, or that somehow it's all I do. And that couldn't be further from the truth. I mean, the truth is my stance is take nothing out of your toolbox. I still do all the bread and butter pediatric dentistry, fillings, crowns, extractions, space maintainers, sedation. I still do all of that. This is just one more thing that I've added in. It's like having one more item on the menu.
Did you get the memo that humans hate change?
That's what I bring up too. It's I'm such a creature of habit. Dentists are very type A. We want, it's hard to change. And a question I'll get is well, how did you end up doing this? And really what it was is as a mom, like we talked about earlier with my daughter having surgery, and that changing the way I wanted to empathize more with parents. And then we talked also about the risks of sedation, which, it's always going to be necessary in my specialty. But if we could do it less,
and
if it could be a last
sedation
resort,
2/3?
that would be great.
You reduced it 2/3?
And so, but I had an emergency situation with an IV sedation patient in my practice many years ago. And, it was one of those events where you feel like you're watching from the corner of the room and everything's in slow motion. And those two things made me...
How did it turn out?
The child was fine. He recovered, but it's still that scary moment where it made me question, what can I do better for my patients, and or what can I do differently? And it was around that time that I read an article by a friend of mine now, John Fricella, on SDF in an online article. And my initial impression, because I'm highly skeptical, I don't like change, was what is this, some hippie tree hugging crap? I just thought it was BS. And that's the thing, is that, that's the initial, because we didn't learn about it in dental school, the knee-jerk reaction of many dentists, and I don't blame them because I did the same thing, is they think this is BS. They don't know that there's this massive body of scientific literature to support its efficacy. And beyond that, beyond when it was created in Japan, if you go back to U.S. dentistry in 1800s or in the early 1900s, where we were using silver nitrate, which is the precursor to silver diamine fluoride, that I never knew that.
But talk about how it was used.
It was used to arrest caries. I mean, they would apply it to carious lesions, and it could arrest caries.
And they use it all over the body.
Sure. Well, that's
Open
the thing.
Wounds,
We've known for centuries that silver is antimicrobial. So
tin.
Right. So going back to the amalgam fillings, that's why you don't see all these recurrent caries around the amalgam fillings, and they last forever and ever and ever.
38 years.
Yeah.
38 years, but who's counting? Obviously not Americans.
But silver nitrate was flawed in that it leached calcium and phosphate from the tooth. So it did leave the tooth brittle. It wasn't perfect. And then I think it was 1908, but G.V. Black went to Colorado to study the mysterious Colorado brown stain, which proved to be fluoride, or fluorosis, really. So when the U.S., kind of in the 1950s or so, we went all in on fluoride. We thought fluoride was going to be the cure-all, and we left silver nitrate by the wayside. But here we are, it's 2018, and caries are still rampant. 91% of the population has caries. So has fluoride cured all our ailments? No. It's a wonderful and important thing, but it's not a cure-all.
And then compare that to STDs. which have almost vanished. I mean,
Right, and why did they vanish? We
because they
focused on
change your
prevention.
behavior, changing
Right.
behavior.
So if we're gonna fix caries, let's get back to the disease and prevention, and not about we need more soldiers and dental therapists and more dentists drilling and filling. You can't drill your way out of a bacterial and behavior disease. Period.
That's going to be your question. You can't drill your way out of this
Right.
disease.
But again, there's always going to be a need for fillings and crowns and cosmetic. Like, yes, it's not going to put us out of business. And even if it did, wouldn't that be a great thing? Do you think if we discovered a cure for cancer, are the oncologists going to be pissed that they're out of job? They should be celebrating,
You know how many of my
right?
cousins and uncles in Kansas believe that there is a cure for cancer and
Right.
it's a
It's like it almost makes you like this conspiracy
Oh,
theorist.
my
It's like, well,
God.
how did I not do? But again, SDF is not a panacea. It's not a cure-all. It's another treatment. And what's special about it is it's non-invasive. So in my patient population, young children who could be traumatized by treatment or who could have adverse outcomes from treatment, or the treatment is more expensive when we're having to do sedation and again, remember our spending is projected to go to $15 billion. If we
Now,
could
what was
do,
that? Was that $15 billion spent in Medicaid or just insurance or just the whole
dental expenditures.
dental expenditures for children?
Here, you want me to look at the
I do. I love.
You're a
love
nerd like me.
I love the numbers. Because dentistry last year, 2017, I believe it was $118 billion for USA. So this $15 billion.
I'm pretty sure it's on children's dental expenditures in Medicaid.
Okay, that makes sense. Dental.
Right. That's why it's a smaller number.
It'd be
Here you go.
15. It'd be 10% of the whole pie.
So, what
oh
of
my
our
God,
current?
that's how I know.
What have our
How
current?
you're young enough to be my daughter. If you're 55, you have to have this size phone with readers.
Yeah, well, my text is much bigger than that because my eyes are starting to go. Read the whole thing. Why not?
So what have our current approaches to caries prevent? Is this your
That's
slide?
a slide from my lecture.
Oh my God. The Healthy People Initiative report that from 1990 to 2010, the percentage of children with untreated decay remained virtually unchanged at almost 30%. In underserved rural and minority populations, the percentage is significantly higher at 50%. During the same period, yearly governmental dental expenditures for children increased from $1 billion to $7 billion. Spending is expected to reach $15 billion by 2020. This data indicates that oral health is not improving in concert with the spending. Nice.
Right. So do you think throwing dental therapists into
Well, I
this
like your
problem is
analogy
gonna
of the lung
solve
cancer.
problem?
It was like,
Yeah.
we don't need another 100 surgeons cutting out
Yeah,
black
we
lungs.
we need to approach the disease differently. So what I'm a proponent of is what the concept of the medical management of caries. And I credit to my friend and mentor Stephen Duffin, who has done he has a CE on Dentaltown on the medical management of caries.
He's in
the
California?
concept,
Where's
he's
he
in
at?
Oregon.
Oregon.
And he was an early adopter of silver nitrate covered by fluoride varnish, which at the time was like DIY silver diamine fluoride, because up until 2015 you couldn't legally purchase SDF in the country. That being said, people would smuggle it in from Japan. I have a friend in LA, Bernard Gross, shout out, who would smuggle in saffride, which is just so funny. Like it's just
Right.
It's freaking fluoride.
And guess what? Really? And guess who I bought this house from?
Tell me.
I don't know if I'm legally to say this, but a person in America couldn't get the chemo for her cancer.
Oh.
So she had to so she sold her house and went to Sweden. It's like, okay, so I'm an American, I'm dying of cancer. I can't,
Yeah,
I'm allowed to die,
Thank
but
you.
I can't be a lab rat.
Right. Well,
That was the most
class-
un-American thing I'd ever seen in my life. That you have to leave the country and die in a foreign land because your government thinks you're so damn dumb that you can't take a drug because they haven't approved it.
Right.
How about burn the FDA down? No, I'm serious.
Well,
FDA
FDA has more to do with the sale of things.
Right.
Well,
Complete corruption.
So,
Anyway,
where did this come from? Oh, so the medical
Because they
management
had
of
to
caries.
illegally bring this stuff in.
Okay, so the medical management of caries is this concept of treating the disease with medicine first, and not as opposed to surgery. So surgery would be the drilling and the filling, the cutting of the tooth surface. That's the surgical intervention, right? But if our first line of defense against the disease, a bacterial and behavioral disease, could be prevention, education, diet modification, topical antimicrobials, bioactive materials like glass ionomer cement that release fluoride and have all these benefits to the neighboring teeth. That is my hope, is that we will at some point hopefully shift somehow. I mean, it's a monumental task, like changing people's mindsets, especially dentists. It's so hard because what they were trained and indoctrinated in dental school, it's almost like a religion. Like, so let's discuss, for example,
it is a religion.
Right, so like the concept of complete caries removal. You know, I was trained that you had to do complete caries removal, which meant drill until you see white. You know, we were almost like dentin racists, like drill till you see white. The problem is sometimes you saw pink because you were into the pulp. But, you know, if you look now at how that's more of a myth, like the concept of complete caries removal is, you're never going to get all the bacteria out of the tooth. It's down in the tubules, right? And then if you place resin that leaks at the margins, you know, you're going to get all this mush.
It glues the walls together.
It doesn't.
And the tooth is stronger than it was before.
It's a cure. So, you know, we have to get over these hurdles. And I should mention there's a newer group or organization called the American Academy of Cariology, which has emerged. And that's one of the hopes, is to impact education in the U.S., because depending where you go to dental school, there is not consistent.
What's the name of the American Academy?
American Academy of Cariology.
Where are they based out of?
Well, it's a national.
I know,
group, and there's people from different states. Like the one I know in particular is Doug Young, who's from University of Pacific. Their meeting this year will be in conjunction with Canberra, which will be in Denver, and then their inaugural meeting was with in Atlanta at the ADA last fall. And I mean, talk about being in a group of like-minded people. I felt like I was at church. They were like, amen, like, because people were talking about what we were just talking about, how, you know, we have to get back to the etiology of disease, and you know, doing more fillings isn't going to improve people's health.
We have, so that's aacariology.org.
Yes.
But, you know, I've, for 30 years, whenever I was with Senator McCain and his wife Cindy, I always said, you know, we got all these great hospitals, and you put casinos on reservations. Why don't you have an FDA-free zone on these Indian reservations? And it'll be $1 billion business for, you know, because again, when this lady had to move, I was saddened, because not only are you going off to get chemo and eventually die, but would you rather die in your home or in a foreign country?
Yeah.
I mean, what's the whole point of hospice? Is that so you can die at home?
Right.
And this lady had to die in a foreign country because of our government. And I'm like, I'm a libertarian. I mean, I've been a registered libertarian my whole life, and I just thought that was the most insulting thing.
Well, on a positive note, with the FDA, they did grant SDF the breakthrough therapy designation, which is reserved for, usually it's given to cancer-fighting medicines, like life-saving drugs for diseases which have no cure. So to give that to a medicine that treats caries, that's like, it's the only oral medicine to ever receive that designation, which that's a big freaking deal.
But you know what's still insulting though? Right now, people in Phoenix who have lung cancer have to fly Southwest Airlines to Havana, Cuba, because the government, we're running like a 0% 5-year survival rate, and they're running over a quarter with this vaccine. Well, but the FDA is investigating it for 3 years. Meanwhile, you have to fly Southwest Airlines, publicly traded, to Havana, Cuba, to have a 1 in 4 shot.
Well, you know, I mean, the classical American arrogance is that we know it all and we're the best and the brightest and the head. But when it comes to dentistry and medicine, we're really behind.
Yeah. Like, whenever I hear an American say, we're number one, it's like, oh, so you've never left the country.
Right.
You've never been to Denmark, Sweden, Switzerland?
We joked about, I was just in Vancouver lecturing at the Pacific Dental Conference, which was awesome. I mean, literally standing room only crowds. And that was one of the things I joked about, is this like American arrogance that somehow we're but meanwhile, like no one knows how to use glass ionomer, and they're not. The Canadians are using glass ionomer.
Let me give you a couple examples. Like, have you ever seen the dike in New Orleans that got hit by that hurricane and flooded the whole town?
Oh,
yeah,
I'm sure.
And then have you ever seen the dikes in Scandinavia? I mean, theirs looks like Star Wars built it, all these cement walls and locks and channels. Then you go to the American dike, and it's a dirt mound. It's like, and it's going to happen again.
Yeah.
And they've already been flooded. They'll be completely washed out again, and they're the greatest. Another one. What's another example? Sydney, Australia. So in America, all the interstates are on the top, and there's not enough of them. You know what they do in Australia? They bore tunnels under the ground. So my brother lives like an hour from the airport, and in a surface car, it would be like an hour, and you get in a taxi or an Uber, and you'd go about 3 blocks, and he drops into some tunnel and is shooting 100 miles an hour.
Oh, wow.
And you pop up on the other side, and it's like, why? And then, like in Arizona right now, the I-10.
Yeah.
They just bought. No, you can't even make this shit up. They just bought a block of houses from 48th Street to 51st Avenue and tore them all down so they can build their little flat interstate. Yeah. Australia would have tunneled under them. And what would the difference in costs be? Because you wouldn't have had to buy two rows of houses 100 blocks long.
Well, let's go one step further. Like, think about when I was in dental school living in Pasadena, the traffic in LA is horrible, right? And they just more recently started having more of the streetcars, or even here in Phoenix, now we have the Metrolink, the light rail. But those were the same train track lines that were used way back when the car industry came about, and they got rid of all the streetcars and basically forced everyone to have a car. It's like ridiculous. Like, what happened to the public transportation?
Yeah, and have you gone down to San Fran, seen the building that's falling over? Have you seen that? They just built a 40, 50-story building, but it's all condos, but it's slowly sliding over. So it's lawsuit galore. People are moving out and all that kind of stuff. And it's the same thing. Like, well, why didn't you go 50 stories down? Because do you think they'll ever get an earthquake again that's a size 8?
They could.
And how do you think that 50-story building's going to do?
Not very well.
Yeah, and it's already falling over now. Right. And if it went 50-story, I don't know. But anyway, but it's all progress. Thanks
We've
for
gone
turning.
on so many tangents here.
I'm just covering did I miss anything?
We have like the same thinking pattern, like all over the place.
God, yeah. And you know what? But seriously, I want to say one thing. I've known you for a long time. Your course is the most viewed, and I know so many people in Phoenix that know you, but you're everyone's mentor. You're everyone's idol. I mean, you're just the most solid person, inside out, dentist, mom, everything. It was just a complete honor that you would drive down to the poor part of town in Phoenix and come do a podcast with me and Ryan. It's truly been an honor. And thank you so much for the shirt.
You're welcome. I hope you wear it. And send me a picture of you in it.
I will.